pandemic continues and vaccinations are set to open to everyone in North Carolina 16 years and older this Wednesday, we have a lot to discuss with university physician Dr. Ginette Archinal tonight. Dr. Archinal, thank you for joining us.
My pleasure.
So as you just heard, a record number of people have traveled this weekend over the Easter weekend. Are you at all concerned about a surge in cases here on campus, with travel and people gathering for the holiday?
The surge will happen. It usually takes place about 2 weeks after the travel. So while it was nice that our numbers are trending down now, they're probably going to go up again later in April. I mean, the recent surge we had is because of travel over the St. Patrick's Day couple of break days. We expect this.
So as more people are getting vaccinated, some people are reporting mild symptoms after getting their first and second dose of the vaccines. How do you recommend that people treat these symptoms, and are there anything that people should not do in treating these symptoms?
The symptoms, anytime you go for a vaccine, no matter where you go for it, you should actually be given a handout on what to expect from the vaccine, because most people do get some symptoms, particularly after the second dose, or even after the first dose if you've had COVID yourself. If the symptoms you're getting aren't on the sheet or you have any worries, that's when you contact your healthcare provider. The most important thing is don't take Tylenol or ibuprofen before you get the vaccine. There is some suggestion that taking those medications before you're vaccinated may blunt the immune response. It's perfectly okay to take them afterwards and to help with all of the symptoms, and there's no reason not to take whatever medication you normally take for aches and pains and chills and headaches. Just don't take them before you go in for the shot.
Yeah, and is the university seeing any cases in people who have received their first dose of the vaccine?
You mean cases of COVID in people who've already had some vaccination?
Yes, yeah.
Yes, there are some, and certainly we have a number of people in quarantine who have had one dose of the vaccine already. But what people need to know is there are 2 doses for a reason, and it takes time to build up immunity, which is why it's 14 days after that second dose or after your Johnson & Johnson dose, if you get the single one, before you can be regarded as immune. That's not unique to COVID-19 vaccines. We remind people every year that the flu vaccine takes 2 weeks to work, and you can catch the flu in that 2 weeks between getting the vaccine and that, between getting your vaccine and before that 2 weeks has actually elapsed.
Thank you for that reminder. Now, I'm curious, the university has announced that fully vaccinated students are exempt from testing and quarantine for the next, or quarantine if they are a close contact for the next 90 days after they get their vaccine. Can you explain from a medical standpoint what's the reasoning behind these changes?
Well, the reasoning behind that is that's basically the CDC guidelines. Until last week, the data only showed that immunity lasted for 90 days. We now have good data showing that the Pfizer vaccine certainly will give immunity, pretty decent immunity, for at least 6 months. We know that vaccines aren't perfect. We know that if you're vaccinated, you're not going to die from COVID, and you probably won't end up in hospital. By following the exemptions as outlined by the CDC, it's a way of saying, okay, we know things aren't perfect, but we're working with you to be realistic, and we know that as a student or faculty or staff person, you're getting the vaccine, and you should get some sort of benefit from getting it. Otherwise, what's the point in having the vaccine? And that's why we're following CDC guidelines.
Yeah, so we've now been living in this pandemic for more than a year, and some people are concerned about mental health, as one student told us earlier today. Let's take a listen to their question.
How all the restrictions that Elon has on the limits of social gatherings and just even classes too is kind of hurting people's mental health.
I didn't hear that terribly well, but I think she was talking about the issues with physical distancing and the lack of socialization from that. I will tell you, mental health, the mental health aspect of the pandemic is something that every clinician is worried about, and not just in college students, in everybody. The university is very well aware of the difficulties about physical distancing and having to limit your bubbles. This is another reason why we're strongly recommending that people do get the vaccine. We're not mandating, we're strongly recommending. And the more people who get vaccinated, the sooner we can loosen up some of those restrictions. The sooner we can perhaps have less social distancing. The sooner perhaps bigger gatherings are going to be permitted. Everyone's aware of the problem, but if it's weighing up depression versus death from COVID, it's a tough call. It's a tough call. There is no good answer. Again, we're following general CDC, local health department, and expert guidelines on that.
And as more people are getting vaccinated, what do you think the fall semester will look like on campus?
I'm sorry, I didn't hear that at all.
Sorry, as more people are getting vaccinated, what can we expect the fall semester to look like?
Well, the goal for the fall semester would basically certainly not back to pre-pandemic, because that we can't predict that everything's going to be fine by then. But I can tell you that the goal for fall semester is a much more normal experience on campus. Hopefully, the amount of physical distancing may be able to be reduced. I'm using a lot of hopefully and maybe here, because this is all up in the air. If we get another surge in 2 weeks that doesn't calm down over the summer, who knows what the fall's going to be like. The planning is for a best case scenario and a what if things are still the same as they are now, if not worse, scenario. One of the beauties of Elon is the ability to pivot at the last minute. So that's why we have two scenarios. Nobody wants to be caught out and surprised either in a positive or a negative way and then have to come up with a plan then.
Very true. And from your medical standpoint, do you think students should be required to be vaccinated in the fall?
I think the whole issue about requiring vaccines is a difficult one. It's not a yes and no answer. It's particularly difficult with a vaccine that is relatively new and has emergency use authorization. Currently, hospitals are not mandating the vaccine for their staff. I know some universities in the country are planning to mandate the vaccine. I think every university needs to look at their own population, what the risks are for that population, and what the voluntary uptake of the vaccine is. Medically, there's no one answer because every individual is different.
Mm-hmm. And now looking ahead to graduation, what precautions do you think students and family members should take as this very exciting celebration approaches?
Really very, very straightforward. For students, I would strongly recommend getting vaccinated, probably with the Johnson & Johnson one, because it means you're relatively immune much faster. For family members planning to come down for graduation, again, vaccination's important. If you choose not to be vaccinated, then 14 days of self-quarantine is a good way to make sure you're not going to bring the coronavirus to campus and infect other people who may suffer from it a lot more severely than you do yourself.
Well, thank you for those reminders, and fingers crossed for a best case scenario next fall. Dr. Archinal, thank you. And as always, for updates on what you need to know about the coronavirus on campus, visit elonnewsnetwork.com.